If a hacker steals your credit card, you can cancel it and get a new one in 5 minutes. But if they steal your medical record, your personal health information, or PHI, they possess a permanent blueprint of your identity. On the black market, a single medical file commands a price exponentially higher than financial data. A stolen password is easily changed, but medical history is permanent. These records link Social Security numbers directly to detailed medical backgrounds and insurance information, identifying markers that stay with a patient for a lifetime. To improve outcomes, the healthcare industry is rapidly digitizing patient care. Hospitals are linking complex systems together, creating a massive, high-speed flow of diagnostic data designed to save lives. But that forward momentum crashes into a serious structural flaw. Much of this cutting-edge medicine actively runs on outdated legacy systems. 21st century data is currently relying on 20th century infrastructure. When attackers exploit that friction, the immediate fallout is brutal. Organizations hemorrhage millions in recovery costs, and years of carefully built patient trust evaporates overnight. Yet the true cost is measured in hours and minutes. A compromised network means locked emergency room screens, delayed surgeries, and inaccessible medication histories. A healthcare cyber attack acts as a direct threat to patient survival. To stop one, we have to look past the top-line damage and completely deconstruct the anatomy of the hack itself. If you map the network of a modern hospital, you'll find thousands of interconnected devices across dozens of buildings, forming a sprawling digital perimeter. Attackers probe that perimeter with distinct strategies. The most aggressive software-driven method is ransomware. Hackers inject malicious code designed specifically to find vital patient data and instantly encrypt it. Suddenly, doctors are locked out of their own systems. MRI machines go dark, electronic health records become unreadable, and all major procedures halt until a massive ransom is transferred. But hackers don't always kick down the front door. Sometimes they slip right through the actual medical equipment. Hospitals are rapidly deploying internet-connected medical devices, often bringing them online without any built-in security protocols. In a hospital network, a single vulnerable device, like an infusion pump, acts as an unprotected backdoor, bypassing main firewalls completely. Once inside, attackers move laterally from that device straight into the core database, siphoning records or manipulating critical tools keeping patients alive. As long as these life-saving hardware units lack basic security standards, the entire infrastructure remains hostage to its weakest link. Still, the most unpredictable variable exists completely outside the software. The highest risk comes from the people working inside the building. Hospitals have to contend with insider threats. These are scenarios where employees or contractors intentionally misuse their security clearance to access and leak confidential patient files. Yet malicious intent is rare compared to the damage done by simple accidents. Many healthcare workers handle highly sensitive data every day while suffering from a critical lack of basic cybersecurity training. Cybercriminals exploit this gap with targeted phishing emails. An untrained staff member assumes a message is from a colleague, and with a single click, they inadvertently hand over credentials to the entire database. Whether attackers use a network intrusion or a stolen password, sensitive information is extracted, sold in bulk, and weaponized for massive identity theft. A negligent click yields the exact same devastating loss of patient privacy as a coordinated ransomware strike. Countering these evolving threats requires a systematic effort to break the vulnerability chain and actively secure healthcare data. Step 1 is proactive discovery. Hospitals must conduct comprehensive annual risk assessments, sweeping the network to patch vulnerable legacy systems. This process isn't static. The moment new technology joins the ecosystem, it is immediately assessed and locked down. Step 2 is strict compliance. Adhering to rigorous frameworks like HIPAA is a non-negotiable requirement for modern healthcare operations. These compliance frameworks mandate precise, role-based access limits. By ensuring staff can only view the data strictly necessary for their specific job, hospitals actively neutralize both malicious and accidental insider threats. Even with the best defenses, absolute prevention is impossible. Step 3 requires a concrete, immediate incident response protocol. When an attack occurs, the sequence must be automatic: contain the breach, assess the damage, notify affected victims, and fulfill regulatory reporting duties. Sustaining defenses requires constant action, aggressively upgrading legacy software systems, and continuous staff training remain the strongest shield against errors. Cybersecurity has moved out of the back-office IT department. It is an uncompromising pillar of patient care, an absolute necessity to secure the digital future of medicine.